I don't know if I'm supposed to give an introduction. Is that how podcasts work?
Yeah,
This is
typically.
okay. Well,
For
this
in
is
case your audience doesn't know who you are.
okay. Well, this is the unbranded podcast. I believe we're calling it. I'm Nick Ridpath. Today we're joined by the one and only, or probably the one of many, Doctor Brandon Tran. Isn't there another doctor that works for like the Buccaneers? Somebody who has your exact same name? Or am I tripping?
Yeah. My boy, Dr. Tran.
The other Doctor Tran.
The
So
no, well, there's two of them. One used to work for the Bucks. The other one used to work for the MLB team down there.
there we go. High standards to live up to, man.
Yeah, I know. Last time when I very first met him, he gave me his Super Bowl ring and handed it to me and said, "You're gonna get this one day." This is pretty sick. Okay, I can rock with that.
Speaking of Super Bowls, I have no idea when this will release. This will probably be the first episode. Super Bowl is last night. Recording Monday after the Super Bowl. We have to talk about Sam Darnold. Absolute beast. I feel
Hey, what a
vindicated.
comeback story, man! What a comeback story.
I think there's 2 points in the Super Bowl I want to talk about, and neither one really had much to do with the game. One, I drafted Sam Darnold in fantasy 2 years ago when he was with the Vikings, and I got flamed. I got called a fucking idiot. I got just shit on, and then I should have won my league. Sam Darnold balled out. And I think Sam Darnold was one of the top quarterbacks this year as well. He was definitely the top quarterback 2 years ago. No, I had him this year too, and he was kind of ass from a point standpoint, but that's one point. Shout out Sam Darnold. Dude stuck with it. Dude's a beast. Stat quarterback class. First one out of that year. I think he was in the same draft class as like Baker Mayfield, Josh
Baker,
Allen, Lamar
Lamar, Josh
Jackson.
Allen. They
Yeah.
all came out together.
Yeah. So Sam Darnold, first one to win Super Bowl. Shout out Sam Darnold. Second thing, fantasy football. Everyone was so upset that Kenneth Walker and Zach Charbonnet were sharing snaps from a fantasy standpoint because they kind of like watered down both their point production. Or you'd have like one guy that would get all the points one week and then the other guy get all the points the next week in terms of like they get down to the red zone and then like instead of Kenneth Walker getting touchdowns, they'd like put Zach Charbonnet in. He scored 2 touchdowns and you're like, shit. Anyways, I think from an actual gameplay perspective, that's incredibly brilliant because
It
Kenneth
worked
Walker.
extremely well. It paid off.
Well, I believe. I mean, I have had him in fantasy for years up until this year, and he's like almost always gotten hurt to some degree, which I don't think is even like his issue. I think it's just like if you get a lot of snaps, like look at Christian McCaffrey, like high usage, you just get beat up a little bit. But like from a load management standpoint, I think Zach Charbonnet tore his ACL in one of the last games in the playoffs, and then Kenneth Walker is still fresh. So I think there's an argument there just from like a load management perspective. I kind of like the two running back thing. Same thing with Travion and Ramondre Stevenson. Like they're both healthy at the end of the year.
I mean, that's the same thing with Montgomery and Gibbs. I mean, like RIP to Lions for whatever happened this season. But I mean, it's the exact same process there.
Yeah. Well, I don't know how many people listening to this give a shit about football. So, Dr. Brandon Tran, I'll make this more about you. For those of you who do not know Dr. Brandon Tran, how would you just give us the rundown? Give us your little elevator pitch.
So I'm a chiropractor by trade. I own Envision Sports Rehab outside of Washington, D.C. So Nick and I get a chance to work hand in hand together with a handful of clients, either online or in person. My entire approach is combining this idea of chiropractic care with rehab and training all into one setting. And that's typically what brings people in, is being able to give them like an accelerated chiropractic physio aspect of care. And yeah, that's really it.
So I'm going to ask you more detailed questions about your past because you have a super interesting career path. But can we first talk about these like fragilista dipshits that are in the clinical space? Whether it's physical therapists, chiropractors, the whole like you are going to get hurt if you train, if you're dealing with an injury, as opposed to like I was just working out with a kid we work on together who I think broke his femur and is recovering from that. And like, he's like, dude, like Brandon worked me out. Like he was just surprised that he was going to get rehab work done. And he was like training hard. Like that was like a total mind fuck for him. Right. So can we talk more about that?
Yeah, man, I think it's a flaw in the system, right? And it was something that I learned when I was in physical therapy school, and the same thing I learned in chiropractic school, where it was just like, this is it. This is the protocol. This is what you follow. These are your resistance bands. These are the adjustments that you're given, and that's basically it. And again, I blame the system for it. The schools, the universities, the system as a whole don't really teach you how to progress individuals, whether that's athletes getting back onto the field or whether that's really just your mom and pop who are looking to go play pickleball, right? You're not really introducing these individuals to movements that they're actually going to be using when they're on the court, when they're on the field. And I think it's one of those things where they just don't teach younger clinicians how to kind of learn outside the box. So it's a flaw in the system. I can't really rag on clinicians, but it's a system thing, man.
Yeah, it still blows my mind. It's like doing a consult like 2 or 3 days ago. It was like a post pregnancy. They're seeing their physical therapist. They're like 8 months removed having their kid, no C-section. I think they were dealing with like diastasis recti, and like, oh, you need to only do like 30% intensity. You can't lift weights. Like, you need to be really like take it really easy. But your core is weak and your glutes are weak. It's like, if weakness is the issue, doesn't strength have to be the solution? And if we're going to get stronger, it would mean incorporating some component of load. And I think you could use that across like a cranky knee, a cranky back. That's actually what I want to get into today, is talking about training around back pain here in a little bit. But like, it just seems like such a flawed thought process. Even if you're taught certain things, it's like inevitably, and it's changing, I think, a lot. But you have to see the value if you're a clinician and getting better on the strength and conditioning side of things. I think it's the same way if you're a strength and conditioning coach or just a coach. You have to start getting better. I'm not saying start doing clinical things, it's outside your scope of practice, but having a better understanding of like what clinical is and how we can bridge that gap, because that's what's going to make you more valuable right now.
No, 100%, and I completely agree, because as you and I both agree, it's rehab equals training, right? That's exactly how it should look. You should have somebody who's going on a tour to gym, and they should be looking at you or me, and they'll be like, oh, they're just working out. It's the exact same thing, right? Because we're made to push individuals, and guess what's going to help them? Getting them to move better and getting them to withstand load, and that's what's going to get them better. And I think one of the biggest flaws, especially as you're talking about your client, it's the nociceptive language behind it, because now we're just striking fear into our patient's eyes of like, oh, hey, if you do anything over 15 pounds, your body's going to explode. Like, no, that's not how it works. And I think that comes into the biggest part of things, as well as just like the communication and the education process that it takes when you're working with clients, either those who are a little bit on the fragile side of things or individuals who can withstand a whole lot more. It's the education on, hey, this is what we're looking towards and these are the goals that we have set in front of us. And it's kind of not steering them away from or fear mongering them, right? That's not the goal. It's to teach them, hey, your body is capable of doing incredible things. We just have to get there.
How many people do you think just they kind of conflate the idea of, okay, I'm in pain, okay, now I'm out of pain, therefore like the issue is solved, as opposed
All
to
the
like
time.
perhaps we're in pain because we lack function.
Oh,
And
all
we
the time.
just but we feel better now because we stopped doing whatever it was that was the actual issue. Like, how many rehab plans do you think where we go in and just kind of do side plank, TKE, whatever? How often do you think people feel better just because they stopped doing whatever it was that aggravated them?
Oh, man, it happens quite frequently because you have pain, right? And guess what? If you rest it for X amount of time, I promise you're going to get better. But also at the exact same time, if you move a whole lot better, I promise you that you're also going to get better. So it's one of those things where the rest is just a band-aid. It's not giving you the solution on what exactly is going on. And if we can kind of teach our systems on the different pain scales and the different pain levels and how to tolerate it while also moving better at the exact same time, we're going to see better results at the end of the day.
Yeah, and just like in terms of not just pain scales, but how somebody responds to pain. I think those can be two separate things. Like, some people might have a 3 out of 10 pain, but they're kind of like very neurotic about it. They're fixated on it and they think it's like inherently a bad thing. Some people will have a 8 out of 10 pain and they're like, nah, fuck it, I'll push through it. Right? How much of that education is just like really, really dialing out who the client's personality is? Like, I always use this analogy, probably a terrible analogy, but I used to have a corgi. And like, I would feed him his like heartworm, whatever pill.
You mean your dog that looked like me?
Yeah, something like that. But like, literally, I would feed him his pill like a treat. He'd just eat it, like no problem. Now I have a pit bull, and it's the stubbornest dog in the world. It's like an old pit bull. I have to take the pill and I have to grind it up into powder and then mix it into the food. And if there is like the slightest little piece that's not ground up, I'll walk over to her bowl after she's done eating, and there's like just like that little piece is left in the bowl. She's cleaned everything else out of the bowl except for that one little piece. All that to be said, like how much of this with clients is like is grinding that up and mixing it in and making it, you know, almost desensitizing them to actually doing what we want them to do, as opposed to some people, obviously, we can just say, hey, like this will make your back feel better in the long run. Do you trust me? And they're like, bet, cool, let's go do it.
No, I see it quite frequently, and it's one of those things where it's you make those small minor changes, and then you just kind of reaffirm them of, hey, you can do a whole lot more now, or just kind of stuff like that.
Dope. I would love to talk about training around back pain. Like that's probably one of the more common ones that I deal with. But first, I want to get into your background as a human. So you are a chiropractor, which is fun to shit on chiropractors. But getting to the point of being a chiropractor, you went through like a pretty interesting journey. I think your background also gives really good perspective for when we do talk about these things in terms of like SNC stuff you've been a part of, neuro stuff you've been a part of, you're traveling the world. Tell us, I don't know, this would be day one, but wherever you want to start, your background.
Yeah, man, and like long story short, it's my life has been a fantastic blessing for me, and everything that has just kind of manifested into itself. It's just I can't ask for anything better, man. But yeah, so I graduated from Mercer University, long time ago now. My time at Mercer, I was a strength conditioning intern, and that was how I spent my mornings. That was how I spent my late evenings. I worked with now I think they're with Tennessee now for the strength staff, but had the opportunity to learn from those guys. I worked with them for football, volleyball, you name it. I got a chance to get that introduction into the strength world from the D1 level, and that was kind of help what set the foundation for me later on. But my main focus when I was in undergrad was I built prosthetics. My mentor created a universal prosthetic design, and he would basically lead a group of people or a group of students to go to Vietnam to just travel through the country building prosthetics for amputees. So he would set up clinics per permission of the university and permission with the country, and we would just have little pop-up shops and just build prosthetics for amputees. So for me, that was like my very first introduction into healthcare. And for me, my family immigrated from Vietnam post-war, so I was always in that position of I want to give back to my community, I just don't know how. And fast forward 11 years later, I just completed my 6th trip this past December, and man, it's been an absolute blessing. After that, after I finished undergrad, I got my very first job as a PT tech / exercise physiologist at Shepherd Center in Atlanta. So that was my introduction into neuro rehab. Had the opportunity to work with incredible individuals ranging from spinal cord injuries to brain injuries, amputees, you name it. And for me, that was kind of what motivated me to really just help people and really put my heart forward. Because when you work with the neuro population, it's tough, man, because the nervous system works in incredible ways. Like for me, I've had drop foot for the past 10 years now, so I have very limited sensation in my toes. I can't really dorsiflex, I can't invert well, and it's one of those things where it really just shows you how incredible the human body is. I had the opportunity to work with paraplegics who, one had jumped out of a building, became a paraplegic, and was walking out of the hospital 2 weeks later. And it's just fascinating what the human body can do. After that, I kind of got lost. I was like, I don't know what to do next. I applied to PT school. I only applied once. And for me, it was like, I had this ego where I was like, no, I'm only going to go to these programs. I'm only going to live in these states. And again, that falls back on me.
Same. Did the same thing. It's like, fuck yeah. Actually, I applied to a couple of like less prestigious ones and I also got denied there. So shout out getting denied to higher ed.
100%. So now it's just like on my side of things, it kind of puts that fire on my shoulder to just kind of do the best I can in terms of treating my clients and my patients, you know. So then after that, man, I was literally working, and after work, I just go fly planes. I was working on my private pilot's license, and literally I pull up to the hospital, leave the hospital, hop into a Cessna, and just start flying around North Georgia. And I was just like, this is my life. I'm gonna figure it out after that.
You're literally like the Dos Equis guy, the most interesting man in the world. It's like, oh yeah, I made prosthetics. Actually, I was a strength intern, lifted heavy weights. Then I was a prosthetic creator and traveling around Vietnam. And then, oh yeah, I went and worked in neuro rehab at a hospital in Atlanta. But in my free time, I go fly Cessnas, get my private pilot's license. You know, it's just typical
and that
career
just became
arc.
routine for me.
And you know what? Fuck it. That's too boring. So I'm going to go, what do they say in Australia? I'm going to go fuck some spiders over in Australia.
So now that leads to the next stage of my life. Decided to apply back to PT school, but I was just like, you know what? I'm going to just go to Australia. I got family out there. Let me move to Australia. Let me see what happens. For me, it was like they were so heavy onto manual therapy. That was just something I didn't get a big opportunity to see with the PTs that I had worked with when I was in the States. So I said, okay, cool, let me apply to school. And I ended up at the University of Melbourne Doctor of Physio program. And that was where I guess I just started everything else from scratch until COVID happened. I literally moved out there MLK weekend of 2020. I was in class for maybe 2 months. And then freaking Rudy Gobert has his COVID outbreak, and then Australia just shuts down.
I forgot that Rudy Gobert was like patient zero in the US.
Yeah, 100%. We were just like sitting there because like the time zone changes, right? So I'm sitting there in class just refreshing ESPN. What's going on with the basketball world right now? And it's like, oh, there's something going on. And the day after, I kid you not, it was just shut down. Everything moves online. I don't see my classmates again, and all I do is I just hop on a Zoom call after that. And I was just like, okay, now this gets a little boring, because like it's very tough for you to work on your manual therapy skills. It's really tough for you to work as a clinician, just completely through Zoom, or I guess learning. Right? You handle remote care extremely well.
I
don't know how
LMT
you do
real
it.
quick if I could do it online. Fuck yeah.
You handle it extremely well. For me, I could not. I needed to be around people.
I'm not a
And
huge online guy. But while we're here, if you're interested in doing online rehab with the two of us, we do have an option for you. Brandon loves being on WhatsApp.
shoot us a DM, and then we'll make it happen. So I'm like stuck in my probably 200 square foot tiny studio apartment. I can't leave my apartment for more than, I guess, an hour. I couldn't be X amount of miles away. So I couldn't see family. I couldn't see classmates. So at this point in time, I'm just like, dude, at this rate, like, let me just go home. So I hopped on the very last flight to LAX. And by the time I land in Cali, nothing. Everybody was just acting like there was nothing going on.
Yeah, dude. Your COVID story is way different than mine. Like, I know the Australians freaked out. But like I was in Miami when this stuff started coming out, and like we got an email from school. I was on spring break, my senior year of college. We got emails from school that was like, yeah, we're gonna extend spring break for a week while we figure this out. And then one of my friends I was down there with was a public health major, and he's like reading all these articles from like the triage shit going on in the hospitals in Italy. He's like, dude, like we're so fucked. And we're like, okay, well, at the least we're in Miami. You know, we're gonna live it up for a week, and whatever happens, happens.
Yeah, so like on my side of things, I was just like, dude, I gotta get out of here. I actually have to get out of here. And then that was actually the very first time I met Shallow. Was when we were just chilling in Melbourne, Australia at Doherty's. I just pulled in one day.
Add that to the resume. Fucking ripping bicep curls at Doherty's in Australia.
So I looked over. I was like, damn, that dude looks really familiar, and it turned out to be Shallow because I was like watching his like whiteboard lectures on like his introduction to pre-script whiteboard lectures that he used to do all
OG
over
YouTube videos
back in the day. So like for me, and then I was like, oh hey, like he looks really familiar. Let me just holler at him across the gym. I was like, hey, yo, dog, and then turned out to be shallow. So we just like ended up shooting the shit for a little bit, and now here we are. But yeah, so I landed back in LAX. I went back to work almost immediately at the hospital, and then I just took night classes. End of the year comes around, and I'm like talking to my school, and I'm like, hey, like, so what next? Like, I can't take any more online classes. Like, what do you want me to do? I was like, oh, well, you can just wait until the border opens up because you're not a permanent citizen, so you can't really come back into the country. And I was like, doesn't help. So I'm applying to every single PT school that has open enrollment, whoever is accepting applications, and I'm just like getting like responses back from the staff. It was like, hey, you have to wait till next cycle. You have to wait till next cycle. You have to wait till next cycle. At this time, I'm like 26, and I'm like, dude, I'm getting too old for this. Let me just figure this out. So I ended up applying to chiropractic school. I had a great chiropractor back in Atlanta. I had met Shallow. I had known of Genta at the time. I was like, man, they're chiropractors. Like, they're cool. And then I started chiropractic school that July. And I was just like, what did I get myself into? Like, I remember opening a PowerPoint. You know my boy Zane. And Alec as well. Like, dude, I remember opening up a PowerPoint and it was like, hey, welcome to magnetic healing. Welcome to somatic healing. And I'm like, what am I getting myself into? I like texted them. I was like, dog, I'm gonna need some help with this class because I don't know what this is. And I'm over here like looking at PubMed, looking at, hey, is this real? And then I'm like copying and pasting it over. I'm like, no, I'm gonna need some help with this. And then you start getting that introduction into like the spine is so fragile, like vertebrae move out of place, XYZ, like subluxation theory. And I'm just like drowning in this material, man. And I'm just like,
just imagine if our spine was actually that fragile. How fucked we would be. We all know
yeah,
our friend that like
you just saying that right there, you just taking a breath to say that, you have just subluxated your entire spine. And now you're gonna need to come see me.
Yeah, no spinal loading. I just was going through some DMs. I have a friend that sends me DMs from a certain somebody who's like very against barbell back squats online. And we can talk about a time and a place, but like no axial loadings allowed because it just gives you absolute spine cancer. And I'm like, imagine being that stupid. Imagine this. Anyway, not to digress. Anyways, spine stuff, fragility. I'm sure at some point you start getting into like business ethics, which is really just you convincing your clients they need to come in 4 days a week for maintenance work for the rest of their life.
Yeah, that was basically what it kind of transpired into, and you should start realizing where it's like you start teaching patients how to become reliant on you without giving them a proper solution on actually how to take care of themselves. And for me, that was one of the things that I absolutely hated because as individuals, I can't understand how we just rip away our independence and just hand it to somebody else and become reliant on them. It's like, hey, Nick, like I got a crick in my neck. I need to come see you every single week, or I need to come see you 3 days a week. Is that okay? And it's like I become reliant on you for giving me the solution without actually giving me the solution, right? So for me, that was like one of the biggest headaches and a large factor on why I wanted to just go out on my own and kind of open up my own practice. It was being able to take the hour, being able to take the 45 minutes to properly walk you through what's going on. This is the homework. I'll see you in 2 weeks. Maybe that. Use me when you need me. Very, very bad business model, I'll tell you that. But that's truthfully how I see care, right? It's both of us working together towards our goal and allowing me to educate you to the best of my ability so that we can then reach the goals that you want to achieve without you becoming reliant on me or without you putting your entire life into my hands. And it's like we have a handful of clients who we treat together and they're understanding of that, where it's like they come to me if nothing else works, right? Where we get them moving well, we load them, we teach them the strengthening exercises, the stretches, XYZ. And after that, it's like, hey, if it doesn't get better, my office is right here. Go see Brandon.
Yeah, I mean, I think it boils down to too, like, are we treating symptoms or are we finding solutions for, like a long-term answer? I feel like so much of clinical care in general, even if we go all the way up to medicine, is based around treating symptoms as opposed to treating whatever the root issue is or the root cause of whatever we're dealing with. So it's like,
Oh, 100%.
sure, we can make somebody feel better. If anything hurts, like even the modalities that you use that are very effective for long term fixes, like in the short term, my back could hurt. You could come dig into my glutes, my QL, my psoas, whatever, and I could feel great getting off the table. Maybe like, and then I don't do anything else. I leave the office, and 3 hours later, my back hurts again. It's like, what the fuck? I felt good off the table, but like now I don't feel good anymore. I guess I have to come back tomorrow and get it done again and do that for eternity, which maybe after a few weeks or a few months, I'm going to feel better anyways, but it's not really improving function or looking at maybe what was causing the issue to begin with, whether it's poor programming, lack of exercise, whatever other aspects could be leading into us having that issue.
Yeah, so it's just one of those things where I like to work with a lot of the clients and just like educating them on, hey, like this is everything that we do in the office, everything that we do on the table is very short term. What matters the most is what you do outside the office. So it's like I give them the introduction on the table, and then we hop into the back facility, and it's just like, hey, we're training now. Like we're moving, we're walking you through that assessment. We're teaching you how to access that hip. We're teaching you how to access that. We're teaching you how to, hey, actually withstand load. And I think that's one of the biggest factor, because like we share a lot of folks who also come from that very workout heavy population. And guess what? What they want to do is they want to get back to working out. So we can't really deprive them of that. We just show them the modifications that are necessary and teach them that, hey, your body's, again, going back to the fragile side of things, your body is not as fragile as what you think it is. And guess what? The light at the end of the tunnel is always bright. You just gotta get there.
Let's build off of this. We can get into what the main topic for today is going to be now that we're 30 minutes in. I'm a great podcaster. I shoot the shit for 30 minutes before we get to the point. You can't really see my whole picture. I'm not gonna lie. This is, maybe I look halfway professional with having a decent mic now, but like half empty wall behind me. I have a degree just to prove that I'm not a complete idiot. Nothing else is hung up on the walls around me. I have plenty of jerseys and things I need to hang up. I'm surrounded by boxes, and this is literally set up on a nightstand. My desk comes in today, so we're getting places slowly but surely. But we're still a bit in shambles in terms of our professional studio here. Anyways, back pain. Building off what you were just saying, how might one train around back pain? And I'll give my perspective. This is why I have you here, because people will be like, you're a personal trainer. You don't know anything about training around back pain. You need to stay in your scope of practice. And it's like, okay, well, I'm only getting out of my scope. I might get out of my scope, but I'm only interjecting if we're working with somebody who is not getting the job done on the S&C side. And I think part of that comes with like, why might we actually need a clinician? First and foremost, it's like making sure we don't have a clinical issue. Like, I don't know if you've had anybody come to you and they have like, oh fuck, like maybe you actually do need surgery, or like maybe you do have like cancer or something crazy. But that's kind of the stuff that you learn in school, right? Is like, when is this actually going to be a bigger issue? Or when you have like a cardiac event. I know Shallow tells some story about a client coming in that's having a stroke, but it presented as back pain or something, or neck pain. Okay, there's like actual clinical issues. But if we're talking about the average person who's looking to train through back pain to some degree or fix their back in the gym, it's probably not of a clinical diagnosis, or at least in terms of like they need to go get help from an ortho right now. Right. So like, first and foremost, like if I'm assessing somebody, it's like, do you have any nerve symptoms? How great is that pain on a scale of 1 to 10? Are you always in pain? Does it kind of differ day to day, week to week, throughout the day? Is it different? And then if we can kind of get a baseline that kind of shows there's nothing there that's like too worrisome, getting into training, it's okay, what feels good? Like, can we just find ways to get somebody moving again? And typically for back pain, especially like which is the most common back pain is like SI joint discomfort, kind of the most common. What tends to bug that the most? Well, probably like heavier lifting, mainly hinging, right? So maybe I'm just going to avoid hinging in the short term, or I'm going to look at hinging on a spectrum. If I'm going to like create some sort of exercise index for hinging, it's okay, maybe like an RDL is bent all the way over. Maybe a trap bar deadlift is slightly more upright. Maybe like a Bulgarian split squat or a step down allows me to get a more upright torso as well while still hinging a little bit. And then maybe I'll go all the way over to doing things like a goblet squat where I'm entirely vertical, and I'll do everything else will be on machines for the day. That's kind of like the first thing that I would look at is like, okay, what out of that on that spectrum, where can I start? Where's a good touch point? Where can I start to get better range of motion through the hips? Where can I start to build better core strength, better awareness around rib cage pelvis relationship? those are the things that I would be looking at. And then if we really need to get further down the hole, it's like maybe some axial loading, like this axial loading bug us. So if I'm doing like a leg press, for example, or if I'm doing like a pendulum squat, maybe something where I'm loading on the shoulders, that would be probably somebody who I'm already working with you with anyways, just because that would probably have more clinical significance. But this is a start point. That's kind of how I would start with someone with back pain. It's okay. Let's do a movement assessment. What feels good, what doesn't feel good. While we're doing that, we're probably going to get a good idea of where they lack movement. Typically, if we lack movement through the hip, or we lack proper core strength or pelvic awareness, whatever it is, those are the things that are going to be contributing to back pain the most. Can we find any of those big rocks that need to be turned over? Almost always that's yes. I would say sometimes all those boxes are checked and we need to look like mainly at lifestyle issues, but that's kind of a good start point from my end. You just elaborate. Where did I go right there? Where did I go wrong? What do you want to add to that?
So I will say I trust you with the more. I trust you more than I do with a couple of other clinicians, just because you've got a great head on your shoulders. So don't ever let anybody steer you away from that. But yeah, so on my side of things, it's just ruling out the red flags that you said, right? So it's understanding, hey, is there a radicular component? Is there pressure on the nerve root? Like what's going on, disc herniations, et cetera, right? But oftentimes what you and I will see is just one of those sprain strains. And those are one of those things where, okay, there's just very tight musculature. They're protecting something. Let's take a look at that. Sometimes it's a mechanical thing or overloading. They're just not recovering well, XYZ. So those are more of like your localized events. And then you have the other side of things where it's the disc herniations, where it's also the patient education behind it. People hear disc herniation, they're like, oh man, if I axial load this, it's going to squeeze out like a donut, right? It's just going to go like this and it's just going to squirt out. And that's not the case, right? And I tell folks this all the time, where it's like, if you were to just walk through Target and you just walk by everybody, chances are a majority of them has disc herniations. It's whether or not it's symptomatic or not, right? But the biggest things after that is understanding that, back pain takes time. And it sucks, but it takes time. But you have to just move. You have to figure out the modifications that allow you to just feel comfortable, right? Where it's like you walk through that hinging process of like, man, if I've been down and I touched my toes and it hurts. Okay, well, how about this? So let's just lay supine and just bring your legs to your chest, right? If that helps, cool, so be it. We'll do that. Migrate into a gar hammer if we can. And then we'll just get you loaded after that. And it just takes time, the progression behind it. And it truly sucks, because a lot of folks, they just want to, they're sold out on this idea from chiropractors, where it's just like, oh, well, if I just go and get my SI joint popped, or if I go get my L2, L3, L4 popped, it's going to make me feel better. And at the end of the day, it's like, okay, could it? Yes. But I also want you to use that as a tool to get you into that direction without you becoming reliant on it. And I think that's where there's that discrepancy between me and a handful of chiros. But again, man, it takes time. And the biggest things between a clinician and a personal trainer or a strength conditioning coach is being aware of the red flags that are there. And it's being able to kind of rule that out before you continue with care.
Yeah, let's talk about a few things here. Let's talk about maybe mechanics that we see that are commonly associated with back pain. Let's talk about programming issues, and then maybe something I'm missing, or lifestyle issues, things that you see often maybe I'm going to miss here. Also, dude, there's this whole camp of people online, especially clinicians, that will say like movement or injuries happen regardless of how you move. Have you seen this? Like the form doesn't matter. Like based off meta-analyses, your form doesn't matter. Have you seen this?
No.
I swear it exists. I haven't seen it as much lately.
Send it to me. I'll take a look at that later.
The next time someone posts about it, I'll send it to you. But it's like, dude, if form doesn't matter, then what the fuck's our job for? What am I doing? Don't pay me. I'm not going to help you at all. I mean, it's like,
just keep doing what you're doing, and eventually you're just going to get hurt regardless.
Yeah, I don't really care what a meta-analysis says, because that's probably a meta-analysis of shitty coaches, right? If we're comparing it to or reverting to the mean or whatever, it's like, yeah, we're probably not going to see an improvement with form, because like, first off, what is form? What are your standards for qualitative data that you're using to assess this metric? And then like, who exactly are we working with? Like what kind of pain are we dealing with? Where is the pain? What are the exercises that we're associating with, pain versus no pain, or correcting the exercise equals whatever outcome. So there's so much that can go wrong there. Anyways, I know based off of probably tens of thousands of reps at this point that there's a pretty big difference between somebody doing an exercise with decent form. Again, we talk about that all day long, what that means, and not so decent form. So getting into like things I commonly see like for lower back pain, one would be, we talked about it earlier, like just a lack of the ability to kind of organize the ribcage and pelvis. So I'm not here to like anterior tilt shame people. Like, oh, you have anterior tilt, you're fucked. Like you're going to be so hurt. Like you better fix that. Because it's like, I know all of the fastest athletes that I train, like bias a fair bit of anterior tilt and they move through space. Nothing wrong with that per se, but it's understanding the limitations of that, or really the repercussions of that, especially when we get into an isolated environment. So it's like, if that's how they organize themselves in sport, maybe in more of an isolated environment, we should get better at finding a neutral pelvis, right? Creating pelvic stability, getting some continuity between rib cage and pelvis. When I say that, I mean, think for those that are watching on YouTube, getting stacked. Like this is a nice water glass, nice and stacked. Imagine if I had a Coke can that crushed it in half and then I tilted the top back. It's like now I'm arching to my low back essentially, which again, it's not getting me spine cancer, but probably a little bit less room to move through my SI joint. Probably a little bit less room, maybe even move through my facet joints and my lumbar spine. You can tell me if that's over extrapolating, but anyways, first and foremost, I'd say it's like general core strength, and you'll find a lot of these people just have really weak cores. Like I think that's such a stereotypical like meathead strength coach PT thing to say, like, oh, core and hips, dude. Got to get better hips and got to get stronger core. But it's like in reality,
you're telling me it's not because my glute amnesia that's causing the issue?
And we'll get there next. That's the next thing. Gluteal amnesia. Yeah, you got to get those glutes activated. That's first off, they're inactive. Second of all, they're weak. We'll get into that. I think just as a start point, like getting a stronger core, like I can't tell you how many athletes I've put on a GHC and they can't do 10 reps of GHC sit-ups, or they get back pain doing sit-ups. Like they can't actually get length through the rectus abdominis because they just try to move through the SI joint instead. Or they're just like so stiff to the core. Or just the average like gym pop client, put them on a decline sit-up, they'll do like 5 reps and they're gassed, like 5 reps. It's like, hey, we're objectively weak here. That's a place where we can get strong fast. So it's like, can we build isolated strength? But then also when we're getting into doing movements like split squats, goblet squats, RDLs, can we just maintain a relatively neutral pelvis, right? That's kind of a good start point, I think. What you're mentioning kind of gets into the hip portion. I think I'd probably go more meta first as well, though. Like if I'm looking at somebody doing hinging, doing split squats, doing squats, how do we control our center of mass? If I'm hinging and I'm back in my heels, my center of mass is back, right? I'm not actually in a strong position. It's like weaker positions are probably going to contribute to us having, well, less force output overall, but probably also a weaker brace. Typically, I would associate someone's back pain, I watch them do a hinge. Okay, they're back in their heels, toes are coming up. We can talk about maybe center of mass moving back and the implications about where we're loading as opposed to like loading through the core versus maybe loading more through structure. I would just say generally we're in a weaker position. Get more to the midfoot. We're going to be in a stronger position. We're going to be better overall for a variety of reasons. That's another thing. We could cross apply that to split squats, goblet squats, anything that involves, closed chain, feet on the ground. And then we could get into what you were just saying, like gluteal amnesia. Dude, fuck me. Gluteal amnesia, weak glutes, whatever it is. I think first and foremost, a lot of that comes back to what we just talked about with the pelvis. It's like if my pelvis is in a poor position, I'm not going to be able to really exert force well with my glutes, right? Like my glutes aren't going to be able to do a lot for me if I'm kind of stuck in this anterior tilt. I need relative variability to move to the hips to be able to express, hip extension, external rotation, hip internal rotation, hip flexion. I need to have all those components. And typically what you'll see is like, it isn't that the glutes aren't active. It's that the glutes just aren't able to produce force well because they don't have variability. We're kind of stuck in one range, whether that's more of a, we're stuck in hip ER or we're stuck in hip IR. I just don't have the ability to move through my hip well, so I can't actually express force production or force absorption with my glutes very well. So a lot of the activation drills really come down to like, hey, how can I just get somebody to move through their hips better so now they have the variability they need to express that?
No, and that's all it is, because one of the biggest things that you'll notice is just a deficit in range of motion. And once you kind of teach individuals on how to access that range of motion, guess what? They're going to move a whole lot better. And all of a sudden, their glutes fire, right? Haha, my glutes are now turned on, right? And it's everything that you said is correct, man. It's just like teaching individuals how to be aware of how they move is just what it is. And
yeah, I don't even like
foundation.
Yeah, I don't even devalue like some of the modalities we'll see used, like banded clamshells, monster walks. whatever, that helps you feel your glutes better. Like there is value to having better proprioceptive awareness about where we are in space, especially for muscles that we're trying to use. But like to say that this is like the end all be all, such a dipshit like reductionist point of view. I'm like, dude, that there's more layers to this. It's not the fact that
100%.
we need to get a higher EMG reading on our glutes so we can use them more properly. It's like the car is on, we just don't know how to drive it.
Yeah, it works, but we can also be a little bit more efficient with it by doing this instead.
Yeah, exactly. So
Right? It's not a one size fit all, but if it gets you there and it makes you feel good, hey, by all means, go ahead and do it. But just understand there's a progression that needs to be followed up with that after.
yeah, absolutely. So that's kind of what did we go through so far? Mechanical issues, so center of mass, control of the pelvis, core strength, hip mobility for the most part. Those are kind of the main offenders. Anything else I'm missing there? From a programming standpoint, I commonly see it with, so we could look at it through the lens of just managing load in the program. And maybe it's not how we manage load. I would look at the things we just mentioned on how we're managing load. I would look at a poor program from the standpoint of, okay, this is just too much load. Like there's no possible way we could manage this, even with peak genetics and a ton of drugs. I think of like every bikini bodybuilding program I've ever been sent and how many hinges are in there. Or I think of like selling the story the other day of a client who they were training for a half marathon and didn't tell me. You know who you are. I promise you they're watching this too. They were training for a half marathon and didn't tell me. And they were probably like 5-6 weeks into training. And they just got knee pain out of nowhere. Like, I don't know why my knee's hurting. And I'm like looking to the program. I'm like, okay, did I do anything here that could bug you? Like what's going on? Because it sounded just like, very standard like patella tendonitis. Like, well, what's different? And I'm like, question them. And they're like, oh, well, I did start running a little more because I'm training for a half marathon. And I'm like, what the fuck? Okay. Exactly how many miles were you running before you started ramping up? How have you ramped up? And they had gone from like, these are not the right numbers, but let's say it was like they were doing 10 miles a week as a base. And then they went to like 20 miles a week the next week. And then they were doing like 25 and then 30. And I'm like, dude, you've tripled your miles over the course of like 3 to 4 weeks. You've tripled your miles. That's all that it is. It's just a load management standpoint. Like we did not scale them appropriately for what you have the capacity to withstand. Using that more in a training lens, it's like, I've seen so many programs that are like, okay, we're going to do B stance RDL, and then we're going to do like V squat good morning, and then we're going to do leg press, and then we're going to go and do hip thrust, 45-degree hip extension, and then like, I don't know, insert another hinge movement. It's like, we just hinged like 7 times in a day. No wonder your back hurts. Because like, we're probably going to look at their more mechanical factors too and how they move. And like, they aren't checking the boxes we described. And now they're also doing like 17 hinge exercises in a day. It's like, no wonder your back hurts. So like from a programming perspective, do you see other kind of places people fall short in terms, or not really fall short, but just where they go wrong in terms of programming for keeping the low back feeling good? And it's not like a fragilista thing, but like, what else do you see that I've missed so far?
So I'm gonna speak on behalf of like the powerlifting side of things.
But yeah,
Right?
fuck yeah.
Because
No. Hey, Louis said just do reverse hypers and you're good to go.
just reverse hyper and RPE 9 everything, right? It's one of those things, man, where it falls back on the coaches. Truthfully does, because like you program out and guess what? I'm paying you, let's say $300 a month, and this is the program, so guess what? I'm gonna do it. But it's also just the education, and that's why I love a lot of just like RPE based training. It's like, hey, like let's listen to our body and let's prioritize that over anything else, and not necessarily the load behind it. But then you also have some folks who don't really understand RPE, and it's like, well, I have an RPE 9 this week, so now I have to go load 600 pounds on a back squat, right? Meanwhile, we're dealing with all these issues in the low back. So it goes back to, again, education for that. But again, it's over programming, man, because sometimes it's one of those things where less is more, right? Less helps. And it's like, if you take a look at my training and looking at your training at the exact same time, it's one of those things where it's that happy medium of, hey, we're not going to just load everything. Here's probably 4 or 5 movements. We'll call it a day there. There's no need to be spending 2 hours at the gym and 10,000 exercises just on one movement or on one area. So it's just one of those things of coaches who are just giving way too much, because either it's one of those things of their belief, or it's one of those things that they saw on social media of like, oh, I need to, oh, this is a cool exercise. Let me just throw this in too because that's going to be good. And just like also not listening to patients and understanding. Like I've had to break down a handful of programs on my side of things of like, hey, like 10 exercises here is a little too much. You're also not getting sleep. So it's like you're not sleeping, you're not eating, you're spending 3 hours at the gym. Let's maybe cut back on something. Let's prioritize sleep. Let's prioritize nutrition and actually let's get you to recover well before we just load you into all these exercises. But hey, at the exact same time, you're doing way too much.
Yes, usually it's a combination of these things, not one or the other. Which actually segues perfectly into what I want to talk about next, which is like the lifestyle components. Training wise, anything we missed, anything you see in practice we didn't cover, any crazy stories about back pain.
Just this incredible idea of just like, oh, if it's tight, let me just stretch it. Right? Like it's like stretching provides that sensory relief to the brain where, hey, it feels good, but also if it's one of those things where if we're just going to just stretch this tight muscle, we can also just strengthen it or also kind of dabble it through different ranges of motion to really get it to move better. Right? Because like, yeah, can I just lay there for 20 minutes to do a pigeon stretch? Yeah. Am I being productive? Probably not. Like there again, going back to the efficiency of things, like let's be more efficient with and let's have more intent of doing the exercises for everything that we're doing.
Yeah, and it's like, why is the muscle tight to begin with? Is stretching really the solution? And two, if we're looking at what we're doing with stretching, looking at some sort of sensory input or like modulating those receptors, like Golgi tendon organ, muscle spindles, for example, well, it's like, why is it tight? Is it tight because perhaps we are stuck in a more concentric orientation or more eccentric orientation? So we're just kind of stuck in one of those orientations that we can't change shape, therefore we feel tight. Or is it tight from a guarding perspective? Like maybe we're just guarding because we're weak or we're unstable or we just really don't have the ability to load the muscle well. So like stretching might make us feel better in the short term, but it's not really fixing the functional side of what we need to improve there.
Mm-hmm.
But getting into like lifestyle stuff, you mentioned a few things, which I see is so common. Actually, one of the more common things that I see is not poor sleep, although I do see that. I do see a lot of poor things from nutrition and hydration. Stress is also a big one. Actually, let's circle back. Nutrition, hydration, sleep, stress. What else would you group in there?
Those would probably be those are the big ones.
Okay, so the one that I see the most probably is looking at someone's activity level outside the gym. Like, oh, my back hurts. Let me see your steps. Dude, like 2,000 steps a day on average. Like they're just sedentary. Like they're so sedentary, they're just stiff everywhere. Or like this is not just back pain. I see things like knee pain too, even shoulder pain. But you can probably get into like the cardiovascular side of things where like if you have poor cardiovascular health, your recovery probably sucks. Like your training output probably sucks. Like you don't have the ability to actually recover from any workload that you're doing, nor do you have the ability to actually do much workload very well. So I think that's kind of first and foremost, but also from like a rehab standpoint, like low level movement with load is walking, right? Like walking is some stimulus and that's one of the easiest things we can do. So like if walking feels decent, like maybe for these sorts of issues, we just get walking a bit, but other things we mentioned, nutrition, sleep, hydration, which one do you think is the most prominent? Do you think it's typically like poor diet you see the most, things like poor sleep, poor hydration?
On my side of things, it's between sleep and just stress through work, right? We both have a handful of clients who are kind of like in those like exec or higher up positions where they're just like dealing with so much stress. So it's that constant reminder of like, hey, like let's not push it too much at the gym because you also just had a 15-hour workday. Right? Like, let's go ahead and sleep because I know you have folks who get like maybe 2 hours of sleep, 3 hours of sleep, right? And it's not sustainable at that level, right? So it's like being able to take care of those biopsychosocial factors and then kind of migrating into everything else.
Yeah, I think the biggest thing too is like relatively better is still better. That's one of the things
100%.
that I shoot for. So it's like, dude, if you're a grown ass man eating 80 grams of protein, first off, what the fuck are you doing? Second off, hey, like you're 200 pounds, but like let's get to 120. Let's add a shake in if we have to do something. Like let's do something simple, right? If you're getting 4 hours of sleep, hey, let's get 5 hours. Let's get 5.5 hours. Like let's just get a little bit better. If we're getting 2,000 steps a day, let's go for 4. right? Like relative is better, and typically that's enough to move the needle, especially if we are that detrained.
Yeah. A
I
little
think
goes a very long way. You just chase those small little milestones, and then it's going to progress forward after that. You once you build the consistency, then it's going to be just like second nature of like, oh hey, I need to get X amount of sleep, or hey, like I need to eat this.
because the thing is, like, we have to understand to a point too. Like, I know you're not going to sleep 8 hours a night. I know you're not going to eat 220 grams of protein a day. I know you're not going to manage your stress. Like, I know your stress isn't going to go away. A lot of the reason why you're dealing with those things is the reason why you can also afford to pay us, right? Like, they're, like you're saying, like high achievers, they're working very hard, they've done well in their career, or they have families, right? They have kids they're raising, or maybe they're doing both. Maybe they're very good at their job and they have a family at home. I'm not trying to sit on here, like the average dipshit online and just be like, oh yeah, you need to sleep 9 hours and you need to get your red light therapy in, and need all your protein, but avoid seed oils too, and buy this fancy mattress and like do X, Y, or Z supplements. And it's okay. Like, I'm not here to sell you on that. I think if we just get relatively better, we're probably going to see a lot of progress. It doesn't have to be perfect.
Nope, I agree.
Back pain. Anything else we missed? I think that's a pretty good summary from a training perspective. We went over all the contraindications, movement things to look for, good and bad programming practices, lifestyle issues. I think that's enough to put a bow on that. Yeah. Before we do our segments.
Yeah.
You're the first one I'm workshopping segments on, by the way.
Perfect. I'm honored.
All right. Let's do love it or leave it. In the industry right now, this could be S&C, it could be chiropractic, it could be clinical as a whole. Give me something that you love that's going on, that you think we're really getting things right, and give me something that you think needs to be left in the past.
Left in the past, you already know where I'm headed. It's that adjustment side of things. Like, let's not be reliant on adjustments. Let's actually utilize adjustments as an extra tool in our tool belt to properly educate patients.
So you're gonna get like a hit placed on you for saying that. So somebody high up in the chiropractic, whatever legion of whatever, is gonna put a hit on you for. Did a chiropractor really just say that adjustments are overrated, basically?
I mean, that's the honest fact behind it, right? I would group it up there with cupping, occasionally dry needling as well, where it's just like this is a tool to get you to the next phase. Let's not become reliant on it, right? So it's like between massages, cupping, adjusting, dry needling, all of those, like those are very short-term methodologies to just kind of push you into the next position. And then guess what? The next phase is getting you into the gym and getting you to move better, right? So I would say leave it, man. Like, and I also have a handful of folks who also don't like to be adjusted. So it's like, hey, it's a win-win for me.
Imagine somebody who doesn't want to be adjusted getting adjusted.
I actually had somebody ask me the other day, when was the last time I got adjusted? And I was like, maybe 2.5 years ago. When was I still in school? Yeah, probably then.
I'm not gonna lie, dude. I love it.
Oh, I know.
Crack my spine, dude. It feels so good, and like I get instant relief. But although like 2 hours later, I feel the exact same. But that's the point too, right? It's like it's a tool that can be valuable. So like if I were to get my T-spine manipulated, and then I go do some targeted thoracic rotation drills, lateral flexion, extension, whatever, flexion, extension, that would probably give me a better long-term outlook. And I'd be able to do those drills easier after getting adjusted. But me just coming in and getting adjusted 4 days a week is not going to do dick for me getting a long-term fix. That's kind of the whole point.
Yeah. Again, hey, there's a time and there's a place. If it works for you, it works, right?
Right.
So there's a time and there's a place, man. You know what I will also leave behind? 2-hour warm-ups or an hour warm-up.
Dude, prehab? Can we leave the word prehab behind? Anytime I hear the word prehab, I get fucking triggered. I don't know what it is. I think it's because I associate it with just like it's always followed up with a laundry list of just dumbass exercises that aren't doing anything. And this is not prehab work. This is just keeping you busy. This is delusion is what it is. Like, tell me how all this mini band, whatever, rolling around on the ground stuff is going to do dick for me. And I'll be honest, there's probably a couple things in the common ones that you'll see that I actually like, but it's like, what even is prehab? A warm-up? Like a good warm-up? Things that are meant to prevent us needing rehab? Is that what it's really like? I don't know what the word even means.
So I use prehab more on like the preoperative side of things, right? So it's like, hey, if we're about to go in for an ACL tear, let's focus on the prehab side of things to at least take care of the surrounding musculature before we enter surgery. So then by the time that we enter the rehab phase of things, everything feels good and we're able to actually recover and rehab properly. But the prehab on your side of things is like, hey man, let me go use this foam roller on my low back for the next hour before I go in and pull a sumo deadlift. Right?
Is it
We've seen
implying that I'm gonna hurt somebody? Like I'm doing prehab work because I know my training is so bad I'm gonna hurt somebody. So we're getting ready for this surgery that I'm gonna cause.
so I would just kind of leave out those like long warm ups, man. It's like you can be more efficient, right? And it's just like making sure that you understand the approach to get there. And I think that's what you do a fantastic job at is getting folks warmed up properly and getting them underweight in probably 5-ish, 10 minutes.
Hey,
And
don't
get
glaze me, Dollenstein. No glazing here. Next one. Oh no, you didn't say love it. What do you think? What do you think? Something that we've recently gotten on that you love.
I really love the connection between rehab and strength conditioning. I think that that's a day and age that we are migrating towards, and I absolutely freaking love it, man, because it really just improves patient outcomes. And it could be Gen Pop, it could be geriatrics, it could be athletes. I think it's that approach that has just shown to give fantastic results, man. And it's like
Yeah.
stepping away, like you said, like stepping away from the mini bands and teaching individuals on how to move through movements properly. And I think that truly that has been a game changer. And I think
It, I,
that's where the profession is heading.
yeah, you can definitely see it. When I first graduated school in 2020, one of the first things I did was sign up for level one. And I didn't really know the industry was trending in that direction. I just had more of a rehab background. So I wanted to do PT school. I worked in a clinic for a while, but you see it more and more and more, especially as companies like Preshift have grown. More trainers are kind of adopting this practice, and also more clinicians are getting involved. I can't tell you how many lectures I'm teaching or labs that I'm in that I'm running, and like I see a bunch of clinicians in there. Like it's sick because like they're trying to learn the S&C side, we're trying to learn more of the rehab side, and it's not so we can do each other's job. It's not replacing the other, but it's just understanding like where that spectrum lies and where we can help bridge the gap better, as opposed to just being things that are too entirely opposite of one another. It's like in the reality, it's like there should be good continuity between those two things. So my biggest career advice, if I were to go back to like my younger self, it's like, dude, like go get your LMT at least. Like do something that it allows you to get a bit more hands on. It allows you to kind of bridge the gap a bit better. And that's what I would kind of say to most new coaches coming out as well. It's like, even if you're not sure what you want to do, like give yourself the opportunity to have those options. So that way you can, do more and you can add more value to your career. Fuck it. We'll make that a segment. If you were starting over, what would you do differently?
I would not have chased physical therapy school or chiropractic school to the standard that I have done. I would have just probably probably would have kept with prosthetics. Probably would have gone into like a business major, and just kind of built that foundation there. I would have gained some exposure probably on the manual therapy side of things. So probably just getting my LMT and just combining what I learned from there with the manual side of things and prosthetics, neuro rehab, and then just bridging the gap between strength conditioning and manual therapy. Man, honestly, that's probably what I would have done.
So
I
we're hot on manual. That's the takeaway here.
I love the manual aspect of things because at the end of the day, we are in a patient first setting. And if it means that I have to rub your quad for 10 minutes to make you feel good before we can do anything, by all means, man, I'm going to do it because I know I'm not changing I'm not changing anything structurally, but if I can change the way that the brain perceives what's going on down there, I'm going to do it, man. And that was just something that I felt that was just necessary, and it really gets patient buy-in and it helps. So I would migrate down heavier onto the manual therapy side of things, combining the strength conditioning side, and then probably be in the exact same position I am in now. Truthfully, I would not leave healthcare. I would probably just have changed the journey that I had taken to get here. I would not have
Yeah,
given.
no student loans and a multi-million-dollar prosthetic company running for you.
Yeah, do the same thing I do now and disappeared in the month of December. Preferably not Guatemala. Kidding, enjoyed it. But disappearing out to Vietnam and just serving people, man.
So before I ask you the last one, while I just thought about this, while I have you here, what are some green flags and some red flags for somebody who's looking for chiropractic or physical therapy care?
Number one, the office space, right? So it's like if you're going in and you just see, man, I don't even know how to explain it. It looks like these torture devices. It, like you like hold onto the neck and it just like yanks your neck, stuff like that. If you walk into a facility and all it is it's just a table, there's no weights, there's no racks, there's no turf, there's nothing like that, I probably go the opposite way, right? Or if I sit down on a chair and I see this guy telling me, hey, we're gonna go take x-rays, probably walk out the door. Or if I go in and somebody tries to sell me on a plan to come in 3 days a week for the next 6 weeks, and then 2 days a week for the next 4 weeks shortly after, and then 1 day a week for probably the entirety of your life, I'd probably just walk out the door, right? So those.
I told you the story about going to going to the chiropractor with my mom.
No, what happened?
She was like, so she has scoliosis, and long story short, it's not like a huge deal or anything, but she was like dealing with some back pain at the time. She went to the chiropractor, wanted me to go with her, and I'm listening to this guy like sell her on the idea of like, okay, we're gonna do x-rays, and like he's showing before and after photos, and he's like, yeah, we're gonna put you into like the spinal traction machine every day for like, or how many days a week for this long, and like, here's how much the package would be over the course of however many months. Like basically, I'm just naming the red flags for you right now. And I'm like sitting with my mom, and I'm like, Mom, this guy's a slapdick. She's like, what? I'm like, yeah, this guy's selling you bullshit right now. Like the before and after photos, the before and after x-rays, the spinal traction. And I'm like, dude, like what are we going to do here though? Like there's no rehab department. I'm like, dude, you're wearing jeans and a collared shirt. Like, dude, first off, if you're wearing a collared shirt, that's strike one. Second off, if I see somebody in the office, physical therapy or chiropractic, I've seen more than a handful of people that are working out with jeans on. And there's some caveats. There was a dude at my rec center growing up that would go bench press like 315 for sets of like 10 to 15 with jeans and work boots on every day. And that was the most impressive shit I'd ever seen as a 14-year-old. But as a good rule, if people in your PT clinic are wearing jeans, that should be a red flag to me. Sorry to cut you off. What were you saying?
I was going to mention that I ever tell you the time about one of the clients I had who had like before and after photos of his neck. He was like, well, this doctor said I had military neck, and then he changed it after 3 months. And I said, let me see those x-rays real quick. And it's literally just like a change in the way that his mandible is. And I was like, have you noticed that your chin might be a little bit more tucked here? He was like, oh, no, I didn't know that. It was like, yeah, that's the before and after photo. It's not the same position. You
it's
move.
Like the before and after photos of bodybuilders with like the lighting's different.
Yep. That's all it is, right? Or
dude, you totally recomped. Just like,
oh yeah, man, you're looking good here. You're looking good here. We're making progress.
All right, what else? So that's okay. Red flags. Sorry, before and after photos, X-rays.
Green flags. Green flags are the facility again, right? Racks, dumbbells, barbells. My Beyond Power Voltra that I really love to use right now. Big fan. Shout out to them. But shout also just like
sponsor the pod. No, I'm kidding. That would be fucking sick.
But also, man, it's also the experience behind the clinician as well. Being able to really understand, combining whether they were a trainer before or a strength coach before. It's like understanding, number one, how to communicate with individuals and what it actually means to work out. I saw this one thing of like, you want to go to a personal trainer who's fit, right? And that's typically the case, right? That's how I view it as well. It's like being able to take advice from a clinician who practices what they preach. So that's going down the route of green flags. Those are probably my big ones there. And then you already know my red flags. I could list red flags for days. And
I wonder, before I give one more red flag, I wonder how many of my clients I've sent to you have been like, Nick, what the fuck am I getting into? 'Cause I never give them any backdrop. I'm just like, dude, Brandon's the man. Go see Brandon, take care of you. I never tell them that like you're inside MMA gym. So you walk in and there's like dudes getting punched in the face, and you walk to the back and it's basically a CrossFit gym in the back, and your office is in the front. Like I never explain that to any of them. So I wonder how many of them have gone in and been like, what am I getting into?
yep. And then next thing you know, they're walking out breaking a sweat because they're just like, well, I wasn't prepared for that. I thought I was just going to get a massage. You're going to get a whole lot more than that.
Yeah. Actually, I was just thinking, I have another story as well of chiropractic with my dad, though, not with my mom. So my dad, he won't never listen to this, I don't think. My dad had a new chiropractor who did like the EMF thing on him. Or maybe it's not EMF. It's like the electrical mapping. You know what I'm talking about? I'm not even sure what they do, but they try to map out like your EMG activity or something across your body, and they're like, oh, you're asymmetrical. Like your muscle activation on one side is way more than the other, and they use some fancy equipment. And I was like, yeah, Dad, that's fucking stupid.
Bro, you haven't even seen
he's
like
no, he's smart. Like he's smart. You would like him. He played football in college like you did. I'm like, nah, it's dumb. Like I don't care what he did, respectfully.
Dude, I gotta send you this later. It's the thermography that we used to use, or I guess there's still a lot of folks that still use like the thermography, where it's just like this radar that you go up there, up and down the spine, and there's just like, yeah, you see how it's red over here, you're warm over here, so we have to adjust this one region here. It's like everything else is green. We want this to be green, so we have to adjust this. It's like, man, I'm breaking a sweat right now. It took me so long to get here, just like walking, that I'm overheating because of that.
That's hilarious, dude. I don't know. The gimmicks will jump through to make people give us their money. When I say we, I mean them. Last one. I think it's so annoying to see everyone being so contrarian online. It's the hip thing to do to be contrarian, right? Like, oh, this person said this, that's dumb. Especially the floating head videos, dude. The floating head videos are the worst.
100%. Make your own content.
Let's say not a hot take. Maybe it is a hot take, but a hot take that you actually believe in. Do you have it? Do you have any?
Hot take that I actually believe in. Man, there's been a lot, man. I can't name one off the top of my head.
Okay, no hot takes from Tran, so we'll leave that for another day. Any closing remarks? Anything we missed?
Younger clinicians, don't be scared to think outside the box. That's really it. Don't be scared to deviate from the norm, and don't be scared to deviate from what you were taught in school. Especially like post-op, and you see this with a handful of the post-op guys I work with. It's just like there's the outline of what the surgeon has recommended, but also now he's in your hands, right? The surgeon doesn't work on the rehab side of things, so feel what fits best for you conservatively, right? And don't be scared. And for those who want to venture out on their own, do it. There's never a point in time where I look back and I'm like, dang, I should have just like worked for somebody else. I've enjoyed every single moment, man.
That's such a nice way to end, and I'm not going to let you end because you just brought up something I want to talk about. The variance in prescription of rehab from orthos is so odd to me. Like I've had clients hip replacement, and like docs like, yeah, don't do PT at all. Like, don't do physical therapy. Walk up and down the stairs as much as you can every day for 6 weeks, and then go back to your trainer. Now, he had a good experience with me leading up to the surgery. Prehab, we actually did prehab. He took me out because he wanted to get in shape before surgery. That was the doctor's recommendation. But like, you'll get that all the way to like another client we work with was told they can't do a lunge ever again, which was some sort of broken femur surgery. But anyways, like they're
a football player. For a football player.
Athlete. Yeah, so it's like they can't ever do a lunge again, but they can go play D1 football.
You can like, squat to death, but you just can't do a lunge. Walking lunges are out of your entire exercise program for the rest of your life. But it's also like moving down that surgeon route as well. Like, you know this. I have a handful of folks on teams, and their team doc just so happens to be a shoulder surgeon. And guess what? Anytime that every single one of them goes in, we're going to operate on that shoulder, right? Is it necessary? Probably not. right? So I can go down that rabbit hole as well, but we'll save that for another day.
Yeah, I know you got clients coming in. Not closing remarks. Brandon, where can people find you if they're looking to find you?
Well, my Instagram handle is very simple. I am that short Asian guy on Instagram. So if you guys
Oh
have
yeah.
any questions, or interested in working together, or need a consulting, or want me to consult on anything, please reach out. Please just shoot me a DM, and I will. I look forward to it, man.
Yeah. Long voice notes only. Appreciate you, dude. Thanks for coming on. Brandon will probably be a reoccurring guest on here. So if you guys have further questions for Brandon, give them to me somewhere, and we'll have Brandon back on at some point. If you're not subscribed to the channel or to the podcast, what are you doing? Go do it right now. If you've made it this far, if you've listened to us for over an hour and have not subscribed yet, you're doing it wrong. Please do that. And yeah, stop it there, man.